In 1976, there was an outbreak in Zaire, or modern-day Democratic Republic of the Congo. A team was sent in to investigate. Notably, Dr. Jean-Jacques Muyembe made contact with and took blood samples from a patient with this mysterious disease. He sent the blood sample to a colleague in Belgium who had an electron microscope. Together, Dr. Peter Payet and Muyembe discovered Ebola. This Ebola outbreak was caused by the Ebola virus. It has a filamentous or worm-like shape. Its color is unknown. The whole virus uses a single strain of RNA. Studies suggest that fruit bats are the reservoir for the virus. Oftentimes, symptoms are broad, which include fever, headache, malaise, and myalgias, or muscle pains. Diarrhea, nausea, and vomiting can come up later in the infection. However, there are rare symptoms that include oozing from venipuncture sites and blood present in feces or vomit.
Ebola is spread through bodily fluids or objects contaminated with blood, sweat, or saliva. It can be diagnosed using a PCR test, a urine test, a saliva swab, or a stool culture. Also mention to your healthcare provider if you have been near an Ebola outbreak recently. The immunocompromised, healthcare workers, lab workers, and travelers to Africa, these are all people who are most likely to get Ebola. Ebola is endemic to African nations such as DRC, Guinea, and other West African nations where water sources and wastes are not properly maintained. Infection is sporadic, but the last outbreak in 2014 to 2016 had over 28,000 confirmed cases and over 11,000 deaths. Ebola recovery is different for everyone, since incubation, symptoms, and death may occur in varying amount of times. There are post-recovery complications such as muscle weakness, trouble breathing, transmissibility via semen for 3 months, and joint pain.
Currently, we know that Ebola is endemic to Africa. You can prevent disease by wearing protective clothing, avoiding contact with bodily fluids, and monitoring health after returning from an area with an Ebola outbreak. We have the ERV-EBO as an Ebola vaccine. However, Ebola overall has underscored the fact that many countries in Africa have poorly funded healthcare systems. They are therefore underprepared and understaffed. Some solutions include contacting community leaders and building international relationships.
Being aware of Ebola is important because it is a viral disease that can affect all of us. We should know its severity. In a connected world, it is important that we're all on the same page to build proper responses and address shortcomings in dealing with future epidemics. Also, studying Ebola or any disease is good to provide steps towards new treatments in the medical field.